So, children with cancer require multimodality therapy, and the major modality of treatment is chemotherapy. So, when we give chemotherapy for children, the risk of infection is very high because we are suppressing the immune system and dropping their blood counts as well, which makes them highly vulnerable to infection. So, we need to do everything we can in our everything we possibly can to actually make sure that the infection is minimized, and providing a safe and hygienic environment is a critical component in this. Now, in a place like Mumbai, where accommodation is at a premium, to get a safe and hygienic accommodation which is also spacious for a child is extremely difficult, and St. Jude's has been able to provide that. And hence, it's extremely critical that these children not only go through the journey of treatment, which is very intense, but also be housed in a safe and hygienic accommodation so that infections can be minimized. It is one thing to deliver high intensity cancer care, but if we cannot support the complications which occur due to high intensity cancer care, then we are actually doing injustice to the children. And we can decrease the complications of high intensity cancer care by providing them a safe and hygienic environment, taking care of nutrition, giving the family health education on how to prevent infections, and also take them through the journey of cancer. Cancer centers are far and few in between in the country. Children have to travel long distances and come to the big cities, and they need to stay for 6 months to 1 year to continue their treatment. Now, the hospital only can provide the medical component of it and some support for stay, etc. But in a large centers like Mumbai, thousands of children come for treatment and need to stay in these cities. Huge amount of children abandon treatment because they were not able to get the manage the accommodation and stay in a safe and hygienic environment. St. Jude's has come in and pitched that big gap which was there for children with cancer so that they could stay in these large cities close to the cancer centers for many months, including up to 1 year when required, so that their treatment can go without any interruptions and without any pressure to the family. This has significantly impacted the number of children dropping out of treatment because the family are getting the support. For example, at Tata Memorial Hospital itself, the number of children who abandoned treatment was 25%, and that has now come down to well below 2%. One, their accommodation centers are close by. They take care of all the local logistics, including providing transport for children and the families to come to the hospital as and when required. They actually provide them education, proper nutrition, take care of the children when they are based there so that various activities are being done so that the childhood is not lost because of children taking care of treatment because of the cancer treatment. It's only not the treatment, it's also the follow-up of these children. So once you are a St. Jude child, it does not stop with just treatment. It goes on to make sure that they actually come for a regular follow-up, their late effects are picked up, and on top of it, they also are rehabilitated back into the society. From one point of diagnosis till the child is rehabilitated back into normal life, the whole journey is being taken care of by St. Jude's for the children who are accommodated there. From that point of view, they are an equal partner in delivery of care because we only do the medical component. The rest of it is completely done by St. Jude's. We realized very quickly how important providing safe, hygienic, and a comprehensive accommodation support for children with cancer is. And from the first center which St. Jude's opened in Parel, we straight away saw the benefits of that. So in Mumbai itself, being one of the largest centers in this part of the world, 2,000 children with cancer come here. So obviously, having a few dozen accommodation places or few dozen accommodation units was clearly not enough to take care of the children who 60% of them are or 80% of them are outside Mumbai. So it was our request to St. Jude's that it actually needs to expand because we saw the benefit of it. So why not do it for all the children who come to Tata Memorial or to another or any other cancer center? And that led us to request them to keep on building up on what was really started in Parel to not only in Mumbai but across all TMC centers in the country. And that's the reason we actually ventured into Cotton Green, because we needed a huge support. We needed St. Jude's. We approached and worked jointly with St. Jude's to make sure that it's developed into 167 units and 167 families will be taken care, majority of them from Tata Memorial Centre. And the same thing we wanted in Varanasi. We did not wait for children to come and then build the St. Jude's. We actually, right from the time the children's hospital was conceptualized and the children's unit was being developed, we said this is the time even St. Jude's has to enter right from the beginning, because we don't want to wait for few years and then start working on the accommodation component. The Kharghar facility is going to provide the largest St. Jude center in the country. So we have 167 in Cotton Green. Now we are having 200 plus in the Kharghar Center. So at any time, more than 500 children from Tata will be able to be accommodated in Mumbai in the St. Jude centers. Even though there is a large number of units in Mumbai at the moment, it is still not enough because we are still having lots of patients who need accommodation. And I think providing them accommodation closer to the cancer center will make a huge impact. So we hope that keeping them closer to the new center will help with the logistics of those patients. They don't have to travel far. They are near the hospital all the time. They are in the hospital campus. In an emergency, they can reach the casualty in few minutes and continue with their day-to-day activities in St. Jude's, even though they may have to have an appointment in the afternoon.